The News4ax Trust Index Team is fact-checking a statement made by Governor DeSantis during that news conference, and Tarek is joining us with the findings. Tarek?
Well, the governor pointed to a study that he says reveals that there's no evidence that kids can transmit the coronavirus to adults. Here's why the Trust Index rates the governor's statement as not true. Speaking from a Kissimmee elementary school, Governor Ron DeSantis doubles down on why he says Florida won't close schools again. The governor saying that kids cannot transmit the virus to their parents or other adults, citing a study that originated in Iceland.
There's actually a study out of Iceland that got virtually no coverage here in the United States that was published in the New England Journal of Medicine. They did genetic sequencing of their positive PCR test samples and were able to determine which directions the infections were going. They identified 0 infections going from a kid to an adult.
DeSantis is referring to this study published in the New England Journal of Medicine in June, which in the first few sentences reads, coronavirus was first diagnosed in Iceland at the end of February. However, data are limited on how SARS-CoV-2, the virus that causes COVID-19, enters and spreads in a population. Epidemiologist and scholar Dr. Jonathan Cantor says it's important to put this almost 6-month-old study into context today.
Those were findings that were kind of published very early on. The New England Journal study actually did not specifically note that there was no viral transmission from young children to their parents. That was said in a comment that he made to the news media after that study was published, but that actually wasn't in the New England Journal article.
Cantor says the CEO of the Icelandic company, Carrie Stephenson Deco Genetics, was the person who actually made this statement. Stephenson said in a National Review article, "We have not a single instance of a child infecting parents." But Dr. Cantor says the statement was not published in the actual New England Journal study. In fact, other Icelandic researchers cited in the same National Review article determined that children can indeed carry the coronavirus and transmit it to their parents or other adults.
So you absolutely can get coronavirus from your child. There's no question. If you look at the data from out of Switzerland that were published in the journal Pediatrics, they definitely showed that even young children could transmit coronavirus to adults. So it's definitely possible. It's not necessarily as likely as adult-to-adult transmission, but that may be because of a number of things. For example, kids are less likely to be as sick. So they're not as likely to be coughing as much, so they're not as likely to be expelling as many viral particles.
Now, Governor DeSantis today also wasn't 100% clear when he was talking about school kids. Dr. Cantor says in Florida, school-age kids can vary from ages 5 to 17 or even 18 years old. And we all know that different age groups are remarkably different in how their bodies react to the virus. So the governor's claim that children can't transmit the virus to their parents or adults, the Trust Index is rating that simply as not true. Children can transmit coronavirus to adults, but at a much smaller rate than transmission between adult and adult.